Hi, I'm Dr. Nicole Vane at Moonlight Beach Dental, and one of the things I want to talk about in this video is the life cycle of a tooth. And it's something that most dentists are not even thinking about, nor really are the patients. And it's something that's really important, and it also is aligned with one of my core values, which is being conservative, and another core value, which is really being patient-driven when I'm treatment planning. I'm really trying to think of what's going to be the best outcome long-term for a patient. So when we talk about the life cycle of a tooth, I'm going to use this one as an example. This patient's young. She's in her late 20s, and she already lost a tooth on the other side. And a couple of these teeth got into a bad condition because she's dental phobic. And we can talk about my ability to sedate patients and make them comfortable in another video. But these teeth got into disrepair because she is scared of the dentist. And the other thing is she saw two other people who told her she could only pull the tooth, it couldn't be saved. So my concern at first glance was, yes, this tooth has a big hole in it. And this patient in particular also is very nervous about root canals, the impact on your health, and also the whole procedure of having a root canal done doesn't sound very enticing for a phobic patient. What I looked at when I first saw this is that I have some great technology that I can use to conservatively clean out this decay in a way that's not going to impact the nerve. I saw in the x-ray that the tooth was still alive and that there was enough space between this decay and the nerve that I would be able to get in there and clean it out. So utilizing this technology, I used air abrasion, which is like a high power wash with special particles to clean this area out so the teeth aren't introduced to the trauma of drilling, which is high friction, high speed, and it's also kind of jarring to the tooth, especially when we're close to the nerve. So I'm able to clean this out. This was the end result when I got close to being finished, which was that it was really close to where the nerve was here, but then I used ozone to really make sure this area was disinfectant and also hard enough for me to bond onto in a way that was going to keep the tooth nerve happy. But what was cool is because we have a 3D scanner and I can 3D print pieces of the tooth, I was able to make one here in the office that literally fit all of these pieces so that I preserved this whole side of the tooth and didn't introduce the tooth to further trauma, which is drilling it down to a little nub on an already delicate situation. The other thing is that I was able to get some of her bigger fillings done using these same techniques and just do some fillings on some of the teeth. Next, we're going to address her gums, which had a lot of tartar. I could not ignore the tartar around these and some issues with some of the wisdom teeth. You can see here how they're poking through in an area that's not able to keep them clean. I'll get into some of that in another video, but I really want for people to understand that once we touch a tooth, there's no going back. We can never bring back the enamel, never bring back the health of the tooth. And this patient being in her late 20s, how long can we anticipate her having this tooth based on the quality of the work that we provide as practitioners? So doing this type of dentistry, yes, it's more expensive. It's a lot of extra training and a lot of extra expensive equipment to have here in the office so that we can deliver this quality of care. But it's really important to me that we can preserve teeth and keep them in the patient's mouths as long as we possibly can. And that's a priority here at Moonlight Beach Dental.